obviously, if your blood pressure gets too high, we know how fast that could end your life. And so, blood pressure medications, you need that, right? But the concept is still there, right? So, what is wrong with an individual's health that creates the need for the blood pressure medication to begin with, right? I'm not saying it was only weight, but we know that weight was a big contributing factor. So now that you're stabilizing your weight, now that you're improving your metabolic health, and I'll tell you right now, insulin resistance and chronically elevated insulin levels play a huge role with blood pressure. The goal for everybody that I encourage is to be asking yourself these questions, to be discussing with your PCP, right? When can I start to decrease this medication dose? When can I begin to wean off? These are the questions you guys have to ask because you're not going to get it from your PCP. So prior to all of the GLP-1, have you had a history with weight issues? Is this recent? Has this been an ongoing issue?
I'm 5'2", so I since my 30s, I'm 41 now. Since my 30s, I started packing it on more. At one point in my mid 30s, I think I was like 190. And then
Gotcha.
the weight would disappear. It would go off and then it would come back. And then I'd be, 150 at some times, and then it would jump back up. Boom, 160, 165. Yeah, I was fit in my 20s. Like I was in good shape.
So 20s maintained a high level of fitness, 30s, that's when you notice, but from fit to that's the category where almost nobody does something about it, right? You go from fit, you go to, well, I'm average, right? Like I'm not lean anymore. I'm losing the vascularity. The fitness is gone, but I'm not unhealthy yet. So basically, whenever you, whether intentionally or not, ate less, you would achieve weight loss. But then it seems like afterwards, that's when the weight would just come back.
Yeah, yeah, and it would come back unexpectedly too. Like it just sometimes it seemed like it was slower than others, but then other times it was like, whoa. And then to top it off, I was dealing with high blood pressure, so that was one of the things that I started looking into was what could be a cause.
Yeah, totally, totally.
Yeah.
How's your blood pressure nowadays?
Oh, it's normal.
Yeah,
It's normal. Yeah.
that's fantastic. Did you end up having to start any blood pressure meds?
I was on 3 blood pressure medications.
Ooh,
Yeah, it was high. It'd be like 165, sometimes over like 115.
wow.
Yeah, real high.
Are you still on any meds now, or are you off?
I'm still on them, kind of just taking one thing at a time. So for now, I'm going to continue with it until I can stay stable with the weight, and then from there, try to swing off of them.
Yeah. What have you noticed any? Because this is an interesting topic, right? I don't talk too much about everybody about blood pressure, but very similar concept towards, because again, healthy lifestyle is something that I'm attempting to teach everybody here. And to me, and I think a lot of our members agree, the definition of optimal would be the least amount of medications needed, right? So of course, obviously, if your blood pressure gets too high, we know how fast that could end your life. And so blood pressure medications, you need that, right? But the concept is still there, right? So what is wrong with an individual's health that creates the need for the blood pressure medication to begin with, right? I'm not saying
Yeah.
it was only weight, but we know that weight was a big contributing factor. So now that you're stabilizing your weight, now that you're improving your metabolic health, and I'll tell you right now, insulin resistance and chronically elevated insulin levels play a huge role with blood pressure. So the goal for everybody that I encourage is to be asking yourself these questions, to be discussing with your PCP, right? When can I start to decrease this medication dose? When can I begin to wean off? These are the questions you guys have to ask because you're not going to get it from your PCP. So you have to have that mentality with yourself, that I want to see what it would look like for me to be able to actually wean off the medication. So cholesterol, blood pressure, diabetic medications, obesity medications. As you improve your health, generally speaking, the need for medications should decrease. It's a generalization, right? Everybody has their own unique cases. They come from their own unique backgrounds, and they're going to all kind of go through their own paths. And not everybody's going to wean off of one of those medications. But if you don't have that mindset that that's a goal that you are striving for, then for sure it's not going to happen because unless you're working with a functional doctor that has that mentality, again, our healthcare system doesn't provide doctors like that, and it's not even their fault. They don't get, it's got to go off of a whole conversation there as to basically their doctors are guilty of a healthcare insurance system that barely pays them enough, and they got to see a high volume of patients. So, they don't get the time to do the kind of counseling that some of them actually would like to do. So I like kind of where your headspace is at. It sounds like you're thinking. I want to get to that point, but it sounds like because you just lost the weight, you want to see kind of a little bit more stability.
So absolutely. Um, right now, focus on the weight, and then slowly, speak to my doctor, see if I could just start on two, medications, see how that works out, and then down to one, and then hopefully down to none.
Yeah, and look at the this is actually great. This is so you were on 3 and your blood pressure was still on the higher side, right?
Yeah, at times, yeah, even on the medication, it'd be high. Like I got a blood pressure read cup that I travel with because I travel for work, and I was checking it all the time, and then I'd stop for a while, then check it again, and it would still be around the same level. Sometimes it'd be a little lower, but nothing like it's been lately.
And so
So
that's the thing, right? So you're on 3 meds, right? Again, I'm going to give you guys the general trajectory. This is not medical advice as always, but so he's on the higher range, he's on 3. He starts lowering it, it starts getting down. It doesn't get obviously dangerously too low because that would be a problem. This is the same kind of concept with diabetic medications. If you're on multiple blood sugar lowering medications, it starts getting on the better lower side. You speak to your physician, either they decrease the dose or they say, let's take one off. What's going to happen? It's going to go back up, but then you play that same game. You keep increasing your health, you keep making improvements, you reduce your inflammation, you lower your chronically elevated, and the same thing happens. And then your doctor goes, oh my gosh. And usually, because they don't see this kind of stuff, some of them get really excited. This is really cool to them because think about what they're used to seeing every day. They're used to the slow progression on the other side. So, again, depending on what kind of primary care you have, hopefully they're excited. I always get really frustrated when people are telling me that their doctors are telling them like not even wanting to support this. That's a whole nother problem right there. But yeah, that's that path. Have you had those conversations with your PCP yet? That's the goal that you want to accomplish?
no, I haven't, unfortunately, because my blood pressure's always been really, really high. I have not been able to get it really stable long enough, at least, to venture down that road yet.
Yeah.
Um,
And this is where the nuance of each individual case is going to be the stability. Your case, I would let him know now, or her, him or her, that's your goal. Just again, number one, you want to see where they're coming from, what their thought process is. Are they going to say no, you shouldn't as a generality, or are they going to say no, you shouldn't because you have specific individual reasons? Challenge them, get into that conversation, understand where they're coming from, because if they can't tell you why you specifically shouldn't do it, then
yeah,
do you have the right PCP, right? If they can give you an individual reason why your medical case is a warrant for concern, okay, fine. Then we can have a conversation about it. But I just want to make sure you kind of do that and make sure they're not just giving you this general, well, I've never seen it, so it's not possible. That's where you got to be a little bit careful, and you don't want to have that kind of PCP. So okay, great. So I think that was awesome. So aside from the blood pressure, what currently right now you're at your goal weight, or what are you currently weighing at right now?
I'm getting close to it. I want to try to get to 125 and just kind of play around with it there. I think I weighed in at 129,
Yeah.
so I'm like really close. I watched your video on the Flow University about going just a little bit below your goal weight. So that
Good
way, when you're
idea.
off the medication, because I'm winging off now. So I was taking 50 units, which is 5 milligrams. Tuesday's my shot day. So on Tuesday, I dropped it down to 25.
Yeah.
Uh, I got 3 more dosages of that. And yeah, from there, hopefully I'm down at my goal weight or close enough to it to where I can continue. And I actually start my fast on Wednesday at 8 p.m. So I'm about to end my 48-hour fast in just a few hours. And
Awesome.
it to be honest, like I know I'm at a low dose at 25 units, and I feel strong. Like I don't feel, really any different from the 50 units. I've been using the Cali curve, I believe it is.
Yeah.
Uh,
Nice.
I do like that supplement. That does help a little bit. Um, but I'm feeling strong, like I could do it without the medication.
No, and for anybody that's in the same phase as Jose is, I have the great videos, the actual wean off videos. That's the bread and butter. So go check that out on Flow University. But there is no one way to do it. You know, I've had patients who just hit their goal weight and just went from 50 to 0. Then I've had patients who went 50, 25. I've had them go to 10, 15, trying to get the, you know, you could, it's the same mentality of when you started fasting. And I had that conversation with you guys, and I didn't tell you the rate to progress your fasting. How could I? I'd be guessing probably less effectively than you, because even though I know this, the science of this stuff more than you guys do, I don't know your body more than you do. So the best thing I can do is educate you guys, because the knowledge you have that I don't have is your individual situation, your stress levels, your comfort levels. And so you make the decision. And that's such an empowering thing. And so my philosophy towards weaning off is the same thing.
So I want to know what kind of diet he is. What are you eating? What kind of foods are you eating?
So what I'm eating now is I was trying to stay uh under 50 grams of carbs. So I was really watching my carbs. Mostly the protein is fish and chicken. On Sundays or Saturdays, I would make a steak, or get a pretty good decent sized steak. A lot of vegetables now. Um, I try to squeeze in some pasta here and there. Within staying within the carb range. Sandwiches at work. I would go to our local little spot. It's a Jersey Mike area spot, and get a turkey and provolone sandwich with all the vegetables in it, on wheat. Um, I've tried mixing it up a little bit. I'm staying away from all fast food. Haven't really had like a burger from a fast food joint. French fries. My favorite thing is Wingstop, and I had to cut that out my system. I had to stop that. And I'm cooking my food cleaner. I've switched over to extra virgin olive oil. Um, in the hotels, because I travel, I'm home every other weekend. So in the hotels, I was lucky enough that they give me steamers. So I have a steamer for all my vegetables and everything. Anything that needs to be cooked on the stove, I use the olive oil, the extra virgin.
Awesome.
Uh, and just been using the Fitbit app to help log everything, just to kind of for my own record. I like to keep record of everything, of what I'm putting in my system, what I'm eating. Um, there's a protein shake that I'm taking. It's a meat-based protein shake, and I'd have one or two of those. I believe it has like 24 grams of protein in it, and protein bars also. So I try to get those in there as my snack. Um, haven't had no fat sugar cravings, which I'm blessed, because I used to be a big sugar addict.
All right.
But yeah, pretty much just whatever I can Google. Low carb, high fiber, or not fiber, I'm sorry. Low carb, high calories, and then what I can find. It's a little hard because of the traveling. I'm not
It
real
always
steady.
is. It always
Yeah.
is. And Tina, I'm gonna make two comments. So both for you, Jose, and anybody else, the idea here, once we get several months into this, 2, 3, 4, wherever you want, I do want to see you guys get out of the keto mode now. Now, understand why I say that. Keto's phenomenal, and I think the results from keto are great. It's just not sustainable for 99.9% of people. So if we rely on that, and when it crashes, that's a, especially the longer it is, the greater the likelihood of the crash, and then the feeling of what do I do now, right? So that is the main reason why I want you guys to get back to carbs, is for establishing something that's very sustainable, a lifestyle that allows for carbohydrates. And also it's a test, because if you start introducing carbs back into your diet and you just see all of a sudden the weight loss stops, or, even worse, you start gaining weight, then you stop, you go back to the keto, and we try it again in another month or two. That's all that means. So I definitely want you to try that. Now, generally, I like to see that happen before you start the wean off. So at this point, I wouldn't do all that at the same time, because now you're asking your body for a lot. You're asking it to acclimate to an increased carbohydrate intake while weaning off. So it's okay that we're doing the order a little backwards. Everything is totally adjustable. But for everybody else that hasn't hit your goal yet, I would rather you establish that you can have carbs in your program. And that's a whole other conversation that we're not going to be able to get into, is what do I mean by that? I don't mean high carb. I mean going from keto every day to moderate or carb cycling. And I have videos on FLOA University where you guys can check that out, where I talk about that. Carb cycling is my favorite approach. I like carbs on the weekends and I go keto during the week. It just makes sense for me because I work hard during the week and that's when I fast. That's when I go keto. And then I have so much room for carbs on the weekend. And that's when I lift weights. So that's how I keep my weekly balance. So, and my calories are also higher on the weekend too. It's like my fat and protein never changes, but my calories change just because my carbs change. That's the only difference. So in your case, Jose, we'll adapt this. I would say don't make any dramatic changes in your carbs yet, because now you've already started weaning off. So let's continue the program that you're on and get you stable where you're off the med, 2 to 4 weeks off the med. And then even then, we have a choice to make. When you're off the med, 2 to 4 weeks, weight still stable. We don't want to do both things at the same time. Either you start the carb reintroduction or you start the decrease in your fasting frequency, and, eventually getting through both of those. And then you're at that stable point, and then you transition into the FLOA lifestyle.